happening, patient's going into paralysis, patient needs to be lined up as far as padding on bony prominences. So in your prone kit, you have all of these Mepilex ready for you. They are lined up along completely on the shin, on both knees, on both iliac crests. Sheree, show your iliac crest. On both shoulders, okay? Also, this type of Mepilex on nipples, man or woman, just to protect for abrasion, because we've seen breakdown there. What we didn't do on the last patient is line up the shins. And this is where I've seen most of the problems, is on the shins. So this has to be fully lined up. You don't have to protect the toes, because once we get them into prone, we're floating the feet. So you shouldn't have to do that. Now we're going to take everything off to get ready for prone. So if you have an A-line that is connected to the side of where the ventilator is, that arm is going to go underneath the patient. So the A-line has to be capped off and then recapped afterwards. So we need our nurse up here to cap off that A-line. If a rectal tube is not placed, you should place one because you're going to need it. So rectal tube is in, Foley's obviously in, and everything is midline. With the Foley catheter, and we've forgotten this in the past, is take the Foley holder off the thigh because that stays on, it has that hard piece to it, and we have a pressure sore afterwards. So that comes completely off, okay? Everything stays midline, and if you have to have a nurse at the end of the bed managing, because we also have had patients with chest tubes, which you would keep midline, and that would just rotate with the patient. So everything comes off the patient. Now you're going to pad the patient up like you would.
Leads too.
Yep, all leads are off. Sat monitor can come off, especially if it's on the same side of the ventilator. If everything is on, you can keep it on because it's going to rotate forward, so you don't have to take it off. But if you do take it off, then it immediately goes on. That's one of the first things that should go on once you get them into prone, because you're going to see a sat and a heart rate, and then you'll attach your leads and your A-line. So patient, you would then pad up like you would have a supine patient, whatever you want close to their body. And then you take a full sheet. Now, if you don't already have a full sheet under your patient, a full sheet needs to go below the patient because you need a top sheet and a full bottom sheet, not a draw sheet, a full sheet. So respiratory is going to be in charge, okay? They need to be securing the tube and making sure that we're safe to move, and at least one nurse in charge. I don't want all 6 people talking and giving directions because it becomes chaotic. Okay, so Dina's going to be in charge of, are we safe to move? And I'm sorry, I don't know. Brooke is going to direct where we're going to move. Okay. So what we need to do, because we're always turning towards the ventilator, is we need to position the patient so we have enough room so they don't rotate off the bed. So we have to now move the patient.
So I'm going to just tell, too, if we have 2 RTs, that one of them has the head and one of them has the circuit.
So if we have 2 RTs at the head of the bed, then someone has the ET tube and is securing that. The other person is securing the head and neck. Now remember, patient is completely flaccid, and a lot of respiratory therapists forget this, and we're moving the patient and the neck is going all over the place. You guys are in control of the head and the neck as we rotate. Okay? So we're going to boost over towards the non-ventilator side.
On 3. 1, 2, 3.
And another thing that I forgot is hands are down below her, palms up underneath her hips. So you want to do that first.
So tucked under?
Tucked under, palms up. She's a good patient. Now, the top sheet has to now go underneath the bottom sheet as far as you possibly can tuck it. You guys don't have to do that, just the ventilator side. All right, now the ventilator group is going to help rotate the patient onto their side. So you guys are going to help turn her onto her left side.
Are you guys ready? Yep. On 3. 1, 2, 3.
Now the non-ventilator group is going to pull that top sheet from below when you're ready, and the ventilator group is going to control the descent into prone when Dina's ready.
Okay, on 3. Okay. 1, 2, 3.
Okay? So everything can now come off, and everything gets reattached. Sat first is the first thing you would want to do. And they're fully disconnected.
Flex the seals down.
Okay. So we need a couple of pillows. We've got one. We need at least one more. Thank you. Okay, no, not yet. So,
Oh, not over there yet.
see what Dave just did? Remember, this is not flexion of the shoulder. This is hyperextension, and we can dislocate that shoulder. So you never want to do what we would do in supine, put pillows under the patient. We're not doing that. So we are first going to quarter turn this patient, keeping arms along the side. We'll get her arm a little closer to her. And we're going to rotate every 2 hours. So we're going to start in towards the ventilator position. So now the non-ventilator people, no, up that way.
Oh,
So non-ventilator people are going to rotate her up quarter turn with pillows like we would put a supine patient. Put her back on the pillows. Now Brooke is going to take her upper arm and carefully rotate it downward and forward so that her shoulder is no more than 90 degrees at flexion. We can keep the elbow down, but what we don't want is arm up over the head, because that pulls completely on the brachial plexus, and if we keep doing this for days, we're going to have a brachial plexus injury. So shoulder should never be beyond 90-degree level, always at shoulder level, or a little bit lower, it's fine. And you may need to support. The down arm, we want to make sure is fully depressed, and we don't want to put a pillow there, so this is a little tricky. Her shoulder will, and periodically over time, she might rise up because you might be moving her, so we just want to fully depress, because if the shoulder stays up like this, we're also going to get an injury over time. So position down, never a pillow under here. We don't want to hyperextend her here. Okay, so pillow, palms up, always on the down hand. This is a great position. Okay, so now we spend 2 hours this way. How do we get the head of the bed up above 30 degrees? Reverse Trendelenburg. Never use the head of bed feature, because then we put the back into hyperextension. And then
Can
we
we
also
separate the
want,
leg?
we
Oh,
can
and keep
separate.
from-
You want to do the pillars?
And then we want 2 pillows, or at least one under here.
Just so our
We just
knees
want
aren't
to-
knobbying.
Yeah. So whatever to relieve pressure, you can separate the legs. We don't want, so if you need 2 pillows to come up, that's fine, but we don't want toes touching. Menards are never on in prone, okay? And when we rotate, we'll talk about the menards. But just get the toes off so they're floating. Okay, so now 2 hours this way. Now we have to rotate every 2 hours. So now, Brooke, you're going to bring that shoulder back down. And pillow, no, these can stay because we're just going to rotate. And we're going to take the pillows out. Now this is where people get a little glitched up, especially at night when they're new. Because to rotate the head and neck, we now have to boost off the top of the bed to have freedom to move the head and neck. If you don't do it that way, people think, oh, I've got to lift, I can't rotate. Respiratory saying I can't do this, and we're pulling the whole body up. We're putting her into hyperextension, and everyone's getting a bad back by lifting a heavy body that is dead weight. So we have to boost to the top of the bed. Dina's in control.
On Dina's on.
Okay.
On Dina's 3.
On 3. 1,
Praise don't help.
2, 3.
So we just move the
And
bed.
respiratory, and that's the problem with this pad, it will fall off, so
Yep.
someone has to help with that. Rotate. When respiratory is good, we can come back down.
Okay, on 3. 1, 2, 3.
Pad goes back underneath. 2 pillows, please. Now we're going to rotate up. 2 pillows placed. And I don't know your name. Eric? Eric is going to rotate her shoulder now into position. While other nurses are simultaneously, we're just doing leads. We're not rotating, so leads are still. Okay, so that's your every 2 hours. So now if we're ready to go into supine,